Most, if not all, oncologists realize that vitamin C is a powerful antioxidant. They also know that radiation and chemotherapeutic drugs are highly pro-oxidant or highly toxic due to their pro-oxidant nature. That is why most cancer doctors will recommend against the concurrent use of vitamin C and radiation chemo. Their argument suggests that vitamin C will powerfully neutralize their highly toxic therapies, thereby rendering them ineffective. And in fact, if the vitamin C and radiation/chemo were administered simultaneously, they would be correct. When administration of vitamin C is appropriately staggered from the administration of radiation and/or chemotherapy, the damaging aspects of conventional therapies can be minimized while the cancer-killing properties are optimized. Consider the following points. Radiation/chemotherapeutic drugs weaken all cells exposed to it, yet the desire is to inflict damage on cancer cells alone. Vitamin C enters already weakened cancer cells and facilitates cell death via the Fenton reaction discussed previously. Vitamin C helps weakened healthy cells, including immune system cells, to repair damage to them caused by the traditional therapies, thereby greatly lessening side effects and improving immune function. Vitamin C, in fact, is so good at lessening side effects that oncologists often conclude their prescribed radiation or chemotherapy is being neutralized and therefore not effective. However, studies have shown that vitamin C not only has its own cancer cell killing abilities, but that it actually enhances the effectiveness of chemotherapy. Adverse studies regarding vitamin C in cancer. A few studies have failed to confirm earlier findings of vitamin C's efficacy in the treatment of cancer. However, all of these studies used inadequate doses of vitamin C, and some used oral rather than intravenous administration. Of course, it is well known that every medication is more potent when given by vein rather than by mouth. Furthermore, it is well established that intravenous infusions produce much higher blood levels of vitamin C than oral supplementation of an identical dose. This is especially true when the oral vitamin C is in a water-soluble form. Research shows that as an oral dose increases, the actual percentage of C entering the bloodstream dramatically decreases. Most physicians who utilize vitamin C in their cancer treatment state that doses between 50 to 100 grams per treatment are required. Therefore, it is unlikely that a therapy using only oral supplementation therapy would be effective in treating cancer. Some researchers, however, maintain that oral supplementation can actually improve the efficacy of intravenous vitamin C when used together. As in the treatment of infectious diseases and serious toxin exposures, a dose size that is too small will guarantee unsatisfactory results. Since vitamin C is inexpensive and completely safe, even at intravenous doses of 300 grams, see Chapter 7, there is absolutely no reason to skimp. That is, unless one wants the therapy to fail, as in the Alan Smith case discussed earlier. Conclusion. The cure for cancer has eluded researchers for half a century. Strategies that rely entirely on the use of radiation and chemotherapy drugs, both known to cause cancer and damage or kill normal cells, have not, and dare I say, will never produce anything approaching a victory in this war. What's more, as long as surgery, radiation, and chemotherapy are the only approved modes of treatment, cancer survival statistics will never be acceptable. Vitamin C has been shown to prevent cancer and to selectively kill cancer in both the laboratory and the body. Although I'm not suggesting that vitamin C on its own will prevent or cure all cancers, it does have a track record that shows it is significantly more effective than conventional therapies. If the Food and Drug Administration would lift its unapproved drug restrictions, vitamin C will become a foundational part of many powerful and exceptionally successful protocols used to fight this disease. Vitamin C is safe, inexpensive, easy to use, and prevents, mitigates, and even cures a mind-numbing list of diseases and conditions. Based upon the Cambridge study and my own clinical experiences, I believe that people who reduce their exposure to toxins, particularly dental toxicity, eat a healthy diet, and regularly supplement with high-dose vitamin C would profoundly lower their risk of cancer and heart disease. By this time, it should be easier to appreciate the power of this unmatched primal panacea. And yet, there is still more.